YouTube. Currently on the way to work right now. I thought, why not pick up my phone? I know last video I dropped, I was talking about how my daughter came back positive for COVID. She's doing a lot better. Don't mind me, I really was in a rush this morning to get ready. So my hair looks a mess, but she is doing a lot better. Her cough definitely went away. She still has some runny nose. I mean, it's okay. Like, me and her dad been doing pretty good keeping up on suctioning her nose, you know, because she doesn't know how to blow yet, but she's learning. My baby drank out of a straw yesterday for the first time, y'all. Such a proud mommy moment. But yeah, I just thought I should come on here because y'all just don't, I just have to vent to y'all just don't understand how stressful these past 2 weeks been at work. Like, I feel like being in the healthcare field, I loved it when I first came in. Not saying that I don't love it now, because I love helping people and stuff like that, but it's very frustrating when you have people that you are trying to help, or when, let's say, they're upset about something and you're trying to understand why they're upset, and they just want to be so rude to you for no reason, you know. I had a patient at work telling me yesterday, you know, because she was upset about her wait time, which we had already told her, and you know, she still decided to wait. She comes to the back, you know, really nice to her, really nice to all my patients, and she's just being so rude, you know. After, you know, she just comes up to me being rude, saying she's leaving, this and that. Mind you, our provider's with a whole emergent patient, and I'm explaining to her why she didn't come in yet, you know, because she asked me, you know, because she's saying she's about to leave. Then, y'all, I'm listening to her, I'm hearing her out, and I understand how she feels. Like, okay, I got an appointment, why am I not back at this time? Even though we told her it's going to be wait time, I'm trying to talk to her, you know, I'm definitely understanding her. She said she's going to write a review. She starts writing a review. I said, I understand. So, you know, just write the review, just saying basically that you just don't like the appointment. You know, why should we have appointments if we're not going to go by that, you know? Because I understand where she's coming from. If I was a patient, I definitely understand. But she turns it around, y'all, to say, I don't know myself, and blasey, 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 I'm giving her a headache. And I'm like, what? I'm thinking in my head, I'm being punked, y'all. I'm being punked. Like, no. And then she turns out like, yeah, I'm calling corporate on you tomorrow. What's your name? Whoa, okay. You're mad because you don't feel good, which everyone that came in here don't feel good, but you want to take it out on me, you know? I'm just so annoyed. Like, you got people that don't want to wear masks because they feel like it don't work. It's a big sign on the door that says you have to wear your mask. Like, it's like people want to argue with you. I understand you don't feel good, but you have to understand how us healthcare workers are feeling when we come to work every day. You guys aren't dealing with COVID patients. Yeah, you're going out places or whatever, that's on you, but we're literally set up to see these COVID patients every day, whether they're positive, they come up negative, we're still seeing them, we still have to take care of them. And it's the fact that no one really, I'm not gonna say no one, because some people do understand, but it's these handful of people that don't, that it just makes you not want to really help anyone. Like, why do y'all, like, please let me know, why do people do that? Why be so nasty to someone that's trying to help you? You know, you gotta understand, we're out here every day risking our lives being around these people that have COVID. We're doing that. We're coming here to help you, and you make it seem like it's just a walk in the park job. That's not how it is when you have people that are dying from this virus. You have people dying from COVID. But it's a walk in the park, right? It's okay, we're fine because we're strong, and it's okay. It's not okay. You don't understand that how many people are actually frustrated with it, that we want to get this thing handled, you know, so we don't have to wear a mask anymore, so we don't have to worry about it, you know. I'm not vaccinated, y'all, but I see how the summer is going, and summertime last year was not like this. You had RSV in the summertime for the kids. When have you ever saw that? Like, that's just the craziest thing. And then you have COVID that's coming back, and it's not even winter time yet. So it's like, what do you do to protect yourself if these patients, some of the patients don't care to protect yourself? Let me tell you something. When we pull these patients back to the back, they literally will pull their mask all the way off, knowing they possibly have COVID, because that's what they're coming in to get tested for. But you're a strong healthcare worker, right? You are so invincible that you can't get it. That's not how it is, baby. We are just like you. We're human just like you. There's nothing different, you know? And I just wish that some people are very considerate. I'm gonna tell you, some people are very considerate and some people are very wonderful. I'm not saying every patient I have is bad or rude, because that's not the case. A lot of my patients are great. They're wonderful. If I could give them a hug, I would. Like I said, it's just those handful of people that think that us healthcare workers are so invincible and that we're just saying stuff for our health, and that's just not the case. I just wish people would try to understand this more. Be in our shoes if you were at work, you know, be respectful like we would. Like, apparently we had someone at one of our locations that's not too far from where I work, maybe a few hours away, that passed, and they were young, 26 years old. I'm not that far, you know, behind her. So it makes you feel like it's just sad. Never met the person, never knew them, but still, to me, that's my coworker. That's like coworker family, because you're still working for the same person I'm working for. So of course that hit me. You know, you always hear about places like with people passing away, other jobs and stuff like that, but when that actually happens at your job and you're actually dealing with COVID patients every day, it's like, so it just hits different. It hits so much different, you know. I feel like I have something to live for just like everybody else, but then it's also like you're putting yourself on that front line with these patients, and it's like sometimes you just want to feel appreciated, because yeah, it's our job, yeah, we signed up for it, but did we sign up knowing that COVID was going to happen like this and we were going to be in a pandemic and nobody was going to want to listen? No, we didn't know that. And yeah, like, I thought about getting the vaccine, and I'm probably going to get it, you know, in like a couple of weeks. That's what I plan on doing, because I have to figure out something. Not saying I can't get COVID because I get the vaccine. That's not the case. I've seen so many patients that have the vaccine that come back positive. No, I don't follow up with the patients to see if they've been hospitalized or anything like that, unless we send them to the emergency room. That's the only time I follow up with people. But it's just stressful, y'all. If y'all see a healthcare worker, if y'all see someone that is in this field that is just risking their lives, let them know how much you appreciate them, okay? Let them know you appreciate them. I gotta go, y'all. I'm pulling up in the parking lot. We'll talk later.